World Health Organization stressed that infertility is a disease of the male or female reproductive system, defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility can be primary or secondary. Primary infertility occurs when a person has never had a pregnancy, but secondary infertility occurs when a person has had at least one past pregnancy. So today our group will explain about the causes and the solution of infertility. Cervical mucus problem is one of the causes of infertility which happen in female reproductive system. Cervical mucus secreted by glands in the cervix. There are two functions of cervical mucus. One, to help sperm move through the cervix so it can fertilize an egg during ovulation. Two, to prevent or other substance from getting into the cervix. The cervical mucus can change the structure when the hormone estrogen reaches the highest level just before ovulation. This causes cervical mucus to change from thick cloudy to resembling stretchy raw egg white, which is made easy for sperm to swim up the vagina and into uterus to meet an egg. Abnormal mucus can cause no change as it normally does at ovulation, making pregnancy unlikely to happen. Besides that, allow bacteria in the vagina, usually those that cause infection in the cervix, to enter uterus, sometimes make the destruction of sperm. Lastly, contain antibodies to sperm which kill sperm before they can reach the egg. The solution of this problem are take vitamin B6 and antibiotics that are believed to boost estrogen use at the target organ which is the cervix. Endometrial insemination which are treated by placing semen directly in the uterus to bypass the mucus.
Now, let's talk about the cause of infertility in men, which is blockage of sperm transport. Blockage of sperm transport is blockage in the different ducts that carry the sperm from the testes to the urethra. To fertilize an egg, the sperm must travel from the testes to the urethra via a series of tubes or ducts, which is vas deferens. Some men have sperm duct damage or are devoid of sperm ducts entirely, which can prevent contraception. There are three main causes of sperm transportation. First, congenital disorders, which present at birth. Second, surgical obstruction, which it can prevent the sperm from reaching the urethra. And last, acquired disorder, which is carrying from disease or infection that can interfere the sperm transportation. Volume of semen ejaculated may be less is one of the symptoms with blockage of sperm ducts. This infertility can be treated by specialized surgery. The treatment will be suggested based on diagnostic tests. Transurethral resection of ejaculatory duct surgery is done to unblock the sperm transportation ducts.
Last but not least, let's take a look at the third factor of infertility, which is low sperm quality. Low sperm quality will reduce the chance of successful fertilization towards the ovum. The average sperm count is 75 million sperm per milliliter or per ejaculation. Oligozoospermia occurs when the sperm counts below 15 million sperms per milliliter. Some of the symptoms include erectile dysfunction and also low sex drive. There are three causes that lead to low sperm quality. The first one is due to lifestyle. Alcohol usage, smoking, or taking drugs like steroids to gain body weight can lead to infertility. Next is due to environmental, which is the exposure towards chemicals and heat that will increases the temperature of the testicles will lead to infertility that will reduce the quality of the sperm. Last but not least, let's take a look at the third cause, which is from medical. Cancer treatments or infections from sexual transmitted disease or STD and also surgery history towards the genital organ will lower down the quality of the sperm. There are several treatments that could treat low sperm quality, which is healthy lifestyles, in vitro fertilization or IVF, hormonal treatments for gonadotropins, surgery and counseling, and also intrauterine insemination. In conclusion, infertility can be treated in many ways using modern technologies. couples are able to get a child regardless any health issues they are experiencing with the help of professional medical officers. Thank you for watching.